How to prepare infant formula and feed your baby. Proper preparation of a formula feed is crucial to baby's nutritional intake and minimizes bacterial infection. Preparing infant formula. First, bring tap water to the boil. When using an electric kettle, wait until it turns off automatically. Then leave the water there to cool down for no more than 30 minutes, so that the final water temperature is not less than 70 degrees Celsius. Clean the area where you are going to prepare the feed, then wash your hands thoroughly with soap and water and dry them with a clean towel. Take the bottle out of the bottle sterilizer and shake off any excess water from the bottle and teat. Rinse the bottle and teat with boiled water if they have been sterilized with chemicals. Pour the appropriate amount of boiled water, of no less than 70 degrees Celsius, into the bottle. Add the exact amount of formula powder to the water as described on the label. Adding too much powder can cause dehydration. On the other hand, not enough powder will lead to inadequate nutrition. Loosely fill the scoop provided in the can with formula powder. Level it off, don't press the powder down. Attach the teat and the cap to the bottle. Shake or spin the bottle gently until the powder is thoroughly dissolved. Then quickly cool down the milk to a temperature suitable for feeding. Place the bottom half of the bottle under a running tap or put it in a basin of cold water. Then dry the bottle's surface. Drip a few drops of milk onto your wrist to ensure that the temperature is suitable for feeding. Feeding your baby with a bottle. When feeding, hold your baby such that her head is higher than her body. Gently touch your baby's mouth with the teat and she will turn her head towards it. Keep the bottle tilted so that the milk covers the teat. This prevents your baby from swallowing air during sucking. Stop feeding when your baby shows sign of fullness. For example, when her sucking slows down, if she stops sucking, or even turns away from the bottle. The remaining milk should be discarded. Don't reuse unfinished milk. Never leave your baby alone to feed with the bottle being propped up by a towel or a pillow. It may lead to choking or increase the risk of suffocation. Sleeping with a bottle may lead to tooth decay later in life. Burping your baby. Burp your baby when she finishes the feed. It may prevent her from bringing up milk after feeding. You can also burp her as she pauses during feeding. There are two ways to burp. Hold your baby upright and support her head on your shoulder while you gently pat or rub her back for a few minutes. Alternatively, sit the baby on your lap. Support her chest and head with one hand while you gently pat or rub her back with the other hand for a few minutes. After feeding, holding your baby and keeping her in an upright position for 10 to 20 minutes can prevent bringing up milk. The Department of Health owns the copyright of this digital video. This digital video is produced solely for non-commercial use. It should not be rented, sold or otherwise used for profit-making purposes. Produced in 2015.